Good morning, everyone. I hope you're doing well. Thank you for joining us here in Sacramento on the UC Davis Health Campus. My name is Courtney Lyles. I am the director of the UC Davis Center for Healthcare Policy and Research, one of the co-hosts of this event. And this is our first ever Science for Health Policy Summit that we're holding here today. We intentionally have really tried to keep this interactive and really hope to have a really wonderful day with all of you here today. So I'm first just going to do a couple of housekeeping slides to get us oriented before we dive into the content. I won't read through the agenda, but I just wanted to signal that you have an agenda. There's also a QR code here on this slide if you wanted to see full speaker bios and a little bit more detail about what we'll be up to today. But I really just wanted to draw your attention to this dialogue that we're trying to set up between academia and those working in policy in the executive branch, the legislative branch, nonprofits, community organizations, and others. So we tried really hard to make this about half and half and to really be here with plenty of time for questions and answers in every panel. So thank you. So this is sort of where we're up to today. But before we dive in, we are so fortunate to have the Dean of the UC Davis School of Medicine, Dr. Susan Murin, come up and sort of welcome us and orient us to this wonderful Science for Health Policy Summit. Thank you, Dean Murin.
Thank you so much, Courtney. So good morning, everyone. I'm Susan Murin, as Courtney mentioned, Dean of the School of Medicine here, and it's absolutely my pleasure to welcome you all to today's session. I want to start by thanking everyone who made today's event possible. And I also want to acknowledge that this summit was made possible through funding from our school's Impact Symposia Awards, which are designed to be impactful by convening thought leaders like yourselves to strengthen collaboration on pressing research issues. The theme of today's summit could not be more timely or more vital. Communicating science results, i.e. evidence, to inform policy and bridging communication gaps among key constituent groups is more essential than ever in our current climate. As an anchor institution, UC Davis Health believes fundamentally in fostering and strengthening partnerships with our neighboring communities to improve their quality of life and their socioeconomic vitality. And that mission extends to our partnerships with all of you as we collectively seek to improve the health of all Californians. We are particularly delighted to be hosting this summit here in the UC Davis Aggie Square Innovation District, which was specifically designed with collaboration in mind, bringing together industry, community partners, and academic rigor to translate scientific findings into new ways to improve health and transform lives. About 350 of our School of Medicine scientists and affiliated centers, including our Center for Healthcare Policy and Research, are in various stages of moving into Aggie Square to conduct their collaborative research focused on public health, health policy, neurosciences, cancer, surgical and biomedical engineering, and more. Today's summit is an opportunity to expand our collaborations and strengthen partnerships among academia, our research community, and policymakers. We hope you find inspiration and new connections here today that will create new ways to integrate evidence into the policymaking process. So thank you all for your ongoing partnership. Thank you for being here today, and enjoy today's program. Courtney.
Thank you so much, Dean Murin. So I promised you it wouldn't be an academic conference, and then of course I'm going to start you off with just a couple of slides, but I promise it's just 4 or 5 slides to orient the conversation, and then we'll really dive into some of our dialogue. So this is a picture of us sort of lobbying for clinical and translational science on Capitol Hill earlier this year. So I think the reason we're here today and the level setting that I wanted to do was really the stakes are high. And the stakes have been high before 2025, but they're particularly high in 2025. I think all of us know in health in particular that our health outcomes look poorer than many other international countries globalized international countries. And we spend more on healthcare than most countries that look similar to us, our counterparts, almost 18% of our gross domestic product. So these stakes are high. It means that if we are spending a lot on health and not getting health outcomes, we're spending less on other sectors in our communities and in society, less in education, less in business, across the board. And we also have a particularly important moment because trust is also on the decline. This is the data for trust in science that has been declining since before and after the COVID pandemic. But actually, trust in policymakers, trust in government officials has a similar decline over time. And then lastly, policy is essential because the frontline operations of our public health systems and our healthcare systems rely on policy to be able to operate. So this means it from the high level in terms of where we're spending on GDP, but also to the granular level of what it looks like to practice in a hospital or community clinic or public health department in California and nationwide. So the stakes couldn't be higher. We are fortunate in healthcare that we have tons of data. I would say some other sectors might not be as fortunate of us to think about evidence-based policymaking, but in health and public health and in medicine, we actually have a lot of data. We in academia tend to think about this first bullet quite a bit, clinical trials, academic research. Maybe we think about that one too much. We also have tons of data from government agencies, community-based organizations, nonprofits, working on evaluations, implementations, and programs that we can take and use to use as evidence to decide what's working, what's not working. And then the third one that I wanted to bring today that I hope we'll spend some time talking about is we have expertise. We have expertise from people working in communities, in clinics, in their jobs, and how do we take their expertise and their narratives and use that as primary evidence to make decisions about how policies are rolling out and being effective in their everyday life. And then I couldn't be an academic without giving you one slide, but this idea that we can be working together is something we've been talking about in evidence-based policymaking for many years. I put this up there. There are many, many slides, many frameworks for how to integrate policy and evidence together. But I like this one in particular because it looks like an infinity symbol, right? This figure 8, this ongoing and iterative process that doesn't really have a beginning and an end. And so this is sort of hopefully in our minds as we start our dialogue today about coming into this this infinity symbol from many different places. Maybe as academics, we come into it with our research findings and we want to translate that into a specific policy and program. But you could come into this from the advocacy or the community standpoint and be thinking about what you need to change in your local environment, or from a legislative standpoint of what new policy or program you're going to pass and implement. So no matter where you enter this, trying to think through about how we work together, and then think about outcomes that matter. So not just did it improve a clinical outcome, which sometimes we focus on in academia, but how much did it cost? Did the stakeholders perceive or get benefit from it in the way that we intended? And then lastly, the last slide I wanted to set up us with, I was thinking a lot about our work in the center and sort of what would I say as good or high quality evidence-based policymaking. And I tried to break it down into the ABCs. So you can see if this works for you and keep it in your mind for today. So for me, when I think about what we've been working on in programs and policy translation, you have to have accountability. Accountability comes from transparency. It comes from making decisions and having rationale laid out and holding each other accountable for the decisions that are made. You need to have the best evidence available to you, which we spend a lot of time, again, in academia thinking about, but it needs to be relevant and reliable to improve the effectiveness of policymaking. And then C is really about collaboration and continuous learning. Once you have evidence and you try to translate it, it doesn't stop there, right? It's an ongoing cycle that needs constant iteration and communication, and frankly, iteration. We all know that it needs adaptation after we've implemented a program or a policy. So these are sort of the ABCs I was thinking about, and I'm not naive enough to think that all three of these have particular threats here in 2025. There are threats to them prior to our current environment in 2025, but these exist as a specific moment in time of targeted misinformation campaigns, trying to undercut our accountability or our frameworks for making decision. There's misaligned timing, where we don't have the evidence in the hands of the people who want the evidence at the time in which they make a decision. And then we have shifting attention spans. We have different cycles happening, news cycles, and I think we're still communicating in an old way of how we translate evidence and not in the way in which people actually are receiving information and making decisions today in 2025. So moving forward, I hope that really we can start talking about these. These are some of my ideas in the ABCs to move us forward, but I hope all of you are going to bring your ideas to address these three topics. For me, accountability requires relationships. I don't think we're going to get through this time in a science or in evidence-based policymaking by just generating more facts and putting more facts out there. I think that's pretty clear. It starts with people, it starts with relationships and trust. I think in terms of best evidence, we have to be willing to share information quickly with one another and be honest about the best evidence, pretty good evidence, and not good evidence, and really be able to have communication across groups about that. And then we need a new common language. We need different communication strategies. We can't expect the way we communicated about science 20 years ago is where people are going to science today. So those are the kind of thoughts that I wanted to start us with today, but really, this is the experts that you'll hear from today I think are going to have better and bigger ideas than these to get us started. So with that,